What is constipation? Constipation is a condition in which you may have fewer than 3 bowel movements a week. Stools that are hard, dry, or lumpy. Stools that are difficult or painful to pass. A feeling that not all stool has passed. However, people can have different bowel movement patterns, and only you know what's normal for you. Constipation is not a disease, but may be a symptom of another medical problem. Constipation may last for a short or long time. How common is constipation? Constipation is common among all ages and populations in the United States. About 16 out of 100 adults have symptoms of constipation. About 33 out of 100 adults ages 60 and older have symptoms of constipation. Who is more likely to become constipated? Certain people are more likely to become constipated, including women, especially during pregnancy or after giving birth. Older adults, non-Caucasians, people who eat little to no fiber, people who take certain medicines or dietary supplements. NIH external link. People with certain health problems, including functional gastrointestinal disorders. Symptoms. Causes of constipation. What are the symptoms of constipation? Symptoms of constipation may include fewer than 3 bowel movements a week. Stools that are hard, dry, or lumpy. Stools that are difficult or painful to pass. A feeling that not all stool has passed. When should I see a doctor? You should see a doctor if your symptoms do not go away with self-care or you have a family history of colon or rectal cancer. You should see a doctor right away if you have constipation and any of the following symptoms: bleeding from your rectum, blood in your stool, constant pain in your abdomen, inability to pass gas, vomiting, fever, lower back pain, losing weight without trying. You may be constipated for many reasons, and constipation may have more than one cause at a time. Causes of constipation may include slow movement of stool through your colon, delayed emptying of the colon from pelvic floor disorders. NIH external link, especially in women, and colon surgery. Functional gastrointestinal disorders, such as irritable bowel syndrome. Certain medicines and dietary supplements. Medicines and dietary supplements that can make constipation worse include antacids that contain aluminum and calcium, anticholinergics and antispasmodics, anticonvulsants, used to prevent seizures, calcium channel blockers, diuretics, iron supplements, medicines used to treat Parkinson's disease, narcotic pain medicines, some medicines used to treat depression. Life changes or daily routine changes. Constipation can happen when your life or daily routine changes. For example, your bowel movements can change if you become pregnant, as you get older, when you travel, when you ignore the urge to have a bowel movement, if you change your medicines, if you change how much and what you eat. Certain health and nutrition problems. Certain health and nutrition problems can cause constipation: not eating enough fiber, not drinking enough liquids, or dehydration, not getting enough physical activity. External link. Celiac disease. Disorders that affect your brain and spine, such as Parkinson's disease, spinal cord or brain injuries. Conditions that affect your metabolism, such as diabetes. Conditions that affect your hormones, such as hypothyroidism. Inflammation linked to diverticular disease or proctitis. Intestinal obstructions, including anorectal blockage and tumors. Anatomic problems of your digestive tract. Treatment for constipation. How can I treat my constipation? You can most often treat your constipation at home by doing the following. Change what you eat and drink. Changing what you eat and drink may make your stools softer and easier to pass. To help relieve your symptoms, eat more high-fiber foods. Drink plenty of water and other liquids if you eat more fiber, or take a fiber supplement. Read about what you should eat and drink to help relieve constipation. Depending on your age and sex, adults should get 22 to 34 grams of fiber a day. Get regular physical activity. Getting regular physical activity may help relieve your symptoms. Try bowel training. Your doctor may suggest that you try to train yourself to have a bowel movement at the same time each day to help you become more regular. For example, trying to have a bowel movement 15 to 45 minutes after breakfast may help, because eating helps your colon move stool. Make sure you give yourself enough time to have a bowel movement, and use the bathroom as soon as you feel the need to go. Try to relax your muscles or put your feet on a footstool to make yourself more comfortable. Stop taking certain medicines or dietary supplements. If you think certain medicines or dietary supplements. NIH external link are causing your constipation, talk with your doctor. He or she may change the dose or suggest a different medicine that does not cause constipation. Don't change or stop any medicine or supplement without talking with a healthcare professional. Take over-the-counter medicines. Your healthcare professional may recommend using a laxative for a short time. He or she will tell you what type of laxative is best for you. Fiber supplements, Citracel, Fibercon, Metamucil. Osmotic agents, milk of magnesia, Miralax. Stool softeners NIH external link, Collis, Docusate. Lubricants, such as mineral oil, Fleet. Stimulants, Correctal, Dulcolax. You should only use stimulants if your constipation is severe or other treatments have not worked. If you've been taking laxatives for a long time and can't have a bowel movement without taking a laxative, talk with your doctor about how you can slowly stop using them. If you stop taking laxatives, over time, your colon should start moving stool normally. Eating, diet, nutrition for constipation. What should I eat and drink if I'm constipated? Eat enough fiber. Drink plenty of liquids to help the fiber work better. Fiber. Depending on your age and sex, adults should get 22 to 34 grams of fiber a day. 4 Older adults sometimes don't get enough fiber because they may lose interest in food. Talk with a healthcare professional, such as a dietitian, to plan meals with the right amount of fiber. External link for you. Be sure to add fiber to your diet a little at a time so your body gets used to the change. Good sources of fiber are whole grains, such as whole wheat bread and pasta, oatmeal, and bran flake cereals. Legumes, such as lentils, black beans, kidney beans, soybeans, and chickpeas. Fruits, such as berries, apples with the skin on, oranges, and pears. Vegetables, such as carrots, broccoli, green peas, and collard greens. Nuts, such as almonds, peanuts, and pecans. Plenty of water. You should drink water and other liquids, such as naturally sweetened fruit and vegetable juices and clear soups, to help the fiber work better. This change should make your stools softer and easier to pass. Drinking enough water and other liquids is also a good way to avoid dehydration. Staying hydrated is good for your overall health and can help you avoid getting constipated. Ask a healthcare professional how much liquid you should drink each day based on your size, health, activity level, and where you live. Talk with a healthcare professional to plan meals with the right amount of fiber for you. What should I avoid eating or drinking if I'm constipated? To help prevent or relieve constipation, avoid foods with little to no fiber, such as chips, fast food, meat, prepared foods, such as some frozen meals and snack foods, processed foods, such as hot dogs or some microwavable dinners.